go to the Manitoba website, that for people who are self-isolating, that people who don't have to be vaccinated, they've had, as long as they've had COVID in the last 6 months, that's considered to be the equivalent of that. It's at manitoba.ca/COVID-19/fundamentals. It's actually pretty easy to remember. So if that's one of the fundamentals, we have to ask why it is exactly that the Manitoba government, as we head into the fourth wave, is still providing exceptions to people who've not been vaccinated. Especially when, if you look at the Public Health Canada, you look at the CDC, the recommendations are get vaccinated even if you've had COVID. Because there's lots more science around COVID and vaccinations than people who've had, about recovery and infection rates from people who haven't been vaccinated. The other thing is, I know that Doctors Manitoba spoke today about the serious surgical backlog. It's incredibly disappointing. That since June, there's been, the wait lists have gotten worse, and that there's really no progress with this government. Because, this was, the trough of the wave. This was the time to rebuild. This was the time to make sure that they were getting planning to clear the backlog, which doctors were calling for back in June. And not only are we not seeing that progress, but we're seeing doctors quitting the province right, left, and center. It's really terrible. Yesterday I talked about the case of a doctor who runs the PET machine, which, and all the bungling, years of bungling by Shared Health, where he called for, the people who run Shared Health to either be held to account or fired, because they can't make decisions. And the result is you have diagnostic imaging for people with cancer. We could have 2 machines scanning people, 2,000 people a year each, and it's not happening because Shared Health can't make up their mind. And doctors are quitting as a consequence. And since that story ran about Dr. Demeter, I've heard about other emails from other doctors, an emergency room doctor who's going to move to BC because they'll be respected there. And that's fundamentally the problem, is that this government hasn't been able to get its act together, and it doesn't treat people with enough respect for them to want to keep working. And that's been it's hurting. It has broken our healthcare system.